Hey everybody, welcome back to the channel. If you enjoy this content, please feel free to subscribe and give me some feedback on what we can do to make this channel better. So let's get started on this EKG. This is a really fun one. So we're going to start off by doing what we always do and just get a vibe of what's going on. And I'm going to look here at the bottom of this strip and we'll just see we've got these QRS complexes that are occurring. They seem to be pretty regular, a little bit of an earlier beat there. And we've got a little longer of a pause there, and then back to something, a little bit of a pause here as well, and longer, and then we see it gets shorter again, especially right here. So there is some irregularity to this rhythm, but they're narrow QRS, as you can see if I zoom in here. V6, I've got this nice narrow QRS. And so, first thing I'm thinking is, okay, it's a narrow QRS, it's kind of irregular. Could this be AFib? Could this be some AV block? And so let's take a look and see what the atria is doing. And when I look up to try to find some P waves, I see maybe here in lead 2, I do see some, what appear to be some P waves before QRSs. Here, when I look over here, I see like 2 P waves, and that doesn't make any sense. I see 2 type of kind of waves in the atria, and so I look over and I'm like, well, I know V1 is a great lead to see my atrial activity, and this is what I'm seeing. I'm actually seeing P, P, P. You can even see a P right there on that T wave. And so these are actually evidence of flutter waves, right? There's 1, 2, 3, 4, and on the 5th we get our QRS. And if I look down, you can see it in the other leads. You can see here, you can see P wave, then another P wave. And that's what we're seeing here in AVF, is we're seeing wave, wave, wave as a baseline. And you can even see it on this wave, wave. And there's the wave that's buried underneath. You can see it kind of coming up right here. And so if I look over at AVL, you can see that. You can see these baseline waves that are very regular, that are marching through. And so what we're seeing here is atrial flutter. And that would explain a lot of the variable conduction that we're seeing, right? We're seeing sometimes it's being conducted with a very short R to R. So sometimes the AV node is conducting it at a 2-to-1 ratio. And sometimes, like up here, it's conducting it at a 5-to-1 ratio. So this is with variable conduction. And let's continue down our algorithm here. So we've got an atrial flutter. Let's take a look at my QRSs. My QRSs are upright in lead 1. They are upright in AVF. So that means my QRS axis is going down to the left, which is a normal QRS axis. Next thing I like to do is I like to scan for my ST and T wave segments throughout the anatomical distributions. And what you'll notice is when I come down to these inferior leads, which the inferior leads are leads 2, 3, and AVF, I notice pretty significant baseline ST elevation. And you can see it here in AVF. You got our baseline, you've got elevation, and also here in lead 2, baseline elevation. And so I've got ST elevation in the inferior leads 2, 3, AVF, which is, we know, a hallmark for ischemia or infarction, especially in this case in the inferior portion of the myocardium. And we know that we need to now check the rest of the anatomical leads for some other changes, maybe some reciprocal changes. And what you notice is we've got some depression here in lead 1, depression in AVL. So those are what we would call reciprocal changes. And you can also see over here in the precordium some significant depression in V2 and V3. And when you see depression in the anterior leads, you wonder, is there some posterior involvement? Because we know that the anterior of the heart is recorded by V2 and V3, but the posterior is essentially the inverse of V2 and V3. So if I flipped these QRSs upside down and looked at it from what the back would be, we would actually see ST elevation from the back of the heart. So I would say yes, there is some posterior involvement. So we've got our depression in the lateral leads, which is our reciprocal change. And so what do we see in this patient? We see a atrial flutter with variable conduction. We've got inferior STEMI with posterior involvement. So, hope this helps. Have a great day.